I have some pictures and slides and I'll be talking, but it's certainly interactive, so jump in. I have some questions for you guys too. And we'll be doing a few things with some volunteers, hopefully. So this is mainly about foot care in diabetes and people with poor circulation in their legs, but I thought I'd start by talking a little bit about what I do and how I got there, and what diabetes is and what poor circulation is, and then end with the focus of the research, which is about feet. So what kind of medical doctors do you all know? You guys probably have a family doctor? Yeah, pediatrician? Yeah, so the family doctor is kind of the main person that you'd be seeing, or if you're a kid, then the pediatrician. And they take care of all sorts of problems, whether it has to do with your heart, your skin, your brain, your lungs, your mood, all sorts of different things. And if they need help, there's specialists who can help. So do you know any other kinds of specialists? Radiologist, yeah. Cardiologist for the heart, sure. Anything else? Yeah, for cancers, yep. There's all sorts of specialists. So some specialists are defined based on the kind of patients that they see. So a pediatrician would just see children. Some specialists are seeing just older adults, so that's geriatrics, who focus on older people. Or an obstetrician obviously focuses on somebody who's pregnant. So lots of different specialists like that. And then there are specialists who focus on different areas of the body, right? So you can have a specialist lung doctor, a specialist heart doctor, the cardiologist, a liver doctor, somebody who focuses on intestinal or bowel health, so a gastroenterologist. Or you can have a doctor that focuses on hormones that come from the thyroid or the pancreas, like an endocrinologist who manages diabetes or thyroid problems or other hormonal issues. And there's many, basically any organ has a specialist that focuses on it, except for the foot, but we'll get there. Now, when you come to the hospital, there's other specialists that you might see. So what if you, you cut yourself and you go to the emergency room? So you're likely to see an emergency room doctor who just works in the emergency room. And they might need to get an X-ray or a CT scan, and it's a radiologist that somebody mentioned. And if you need to stay overnight, then there's going to be a doctor who's going to be in charge of your care overnight for however long you need to be in hospital. And they tend to focus on all sorts of medical issues, but just unique to the ones that need to stay in hospital. Sometimes you need to have surgery. So this is Najma Ahmed. She's the surgeon-in-chief here at St. Michael's Hospital. You may have seen her on the news, a lot of news about gun control. And so if you need surgery, you need a surgeon, and a surgeon can't really work without an anesthetist who puts the patient to sleep and keeps them asleep during the surgery. And so that's another specialty of medicine. Now, when it comes to surgeons, like myself, again, there's all sorts of surgeons. These aren't surgeons, these are actors, but they're playing surgeons. And just like the medical specialist, pretty much any part of your body has some type of surgeon that focuses on that. So a brain surgeon, a heart surgeon, a lung surgeon, a liver surgeon, a stomach surgeon, a colon surgeon, or myself, so a blood vessel surgeon or artery and vein surgeon. So I'm a vascular surgeon, and what that means is that I operate and treat patients who have problems with their blood vessels. And there's two types of blood vessels. There are arteries, as you probably know. So those are in red in the body. And there are veins that are in blue. And does anybody know the difference between arteries and veins? Yeah, exactly. Yeah, so veins bring blood to the heart and arteries bring blood out of the heart to the tissues, and then it comes back from the tissues through the veins. So if I just jump forward, so as a vascular surgeon, I deal with a range of issues that affect both arteries and veins. And you can have plaque from cholesterol and calcium that builds up in the arteries, and it can potentially cause a stroke where a piece shoots up into the brain and the person's arm, say, becomes paralyzed, and we need to clean that out to prevent it from happening again. Or in the legs, you can get blockages in the leg arteries that make it hard for somebody to walk, or make their tissues in their foot start dying, actually, and then you need to unblock it to help get better blood flow down to the foot, and that can be done either with a balloon, which is basically what you're seeing here. So you slide a little balloon across the narrowing, and then you balloon it open, Or if it's completely blocked and you can't balloon it, you can actually do something called a bypass, where you take blood from above and bring it around the blockage through the bypass. Other things we deal with, so Dr. Resende is a trauma surgeon, and sometimes he calls me if there's a problem with a blood vessel related to an injury, a gunshot wound, a stabbing, a car accident, and so we have to fix the blood vessel problems there. And then there's varicose veins also, which is an issue with blood flow back up the legs, where people have aching legs because of veins that are bulging and not working well. And the last thing is that arteries coming off the heart, instead of being a nice uniform size like they're shown here, then can actually turn into a balloon, or what's called an aneurysm. And if that gets really, really big, it can burst. And you obviously want to prevent that from happening, so you have to replace that area that's aneurysmal or that's ballooned out. So that's a little kind of overview of vascular surgery. So what do you guys know about how the blood flows in the body? Like, what makes it actually go from your heart to the tip of your finger? Yeah, so, well, the arteries are just like a pipe, right? So the pipe is the artery, and the pipe brings the blood all the way to the finger. But what actually is getting it to move? It's a liquid, right? It's not just, yeah, exactly, the heart. So the heart's a pump, and it's a muscle. So, you know, your heartbeat is the heart contracting, and every time it contracts, it pushes the blood up the artery and then into all the branches of the arteries and into the tissues. And then the pressure also brings the blood back into the heart, but it's mainly the pump of the heart. And there's a whole network of vessels that go to the different areas of the body to bring the blood there, because no tissues really can be alive without blood flow. So that brings the next question. So what's in blood that, like, why do we need blood in our bodies, and what does it do for us? Yeah, so that's the number one thing, oxygen. So oxygen's carried by red blood cells. And all the cells in your body need oxygen for everything that they do and to stay alive. Is there anything else that blood brings around the body?
Nutrients?
Yeah, so sugar, amino acids from proteins, different nutrients for sure. And that relates directly to, you know, diabetes and bringing sugar down to the cells. Anything else? There's a few things in this picture, but does anybody know what a white blood cell is and what it does? Yeah, so white blood cells, and there's other cells like it called immune cells, and that's how your body fights infection, or that's also sometimes why your body gets an allergic reaction. But all these cells have to travel in the blood to get to a certain area to help you heal or fight an infection. And then the last thing that's in the blood, amongst many other things, but there's platelets, which help you stop bleeding if you've cut yourself or you've injured yourself. And it's basically it creates a bit of a dam in a cut and blocks the blood up slowly, and you form a scab that closes up. So how do we check for blood? Blood flow, at least, and you've probably had your blood pressure checked before, but this is a blood pressure machine, and then there's something called a Doppler probe here on the right. And now there are 2 volunteers who wouldn't mind coming up, preferably wearing t-shirts. Sure. Yeah. Okay, sure. Okay. So we'll start with, yeah, if you can come up. Yeah. Okay, sorry, what's your name? Callista, okay. So we'll start with the blood pressure on Callista here. So here, I'll just line that up. It's maybe a little bit big. Okay, so just relax your arm there. Okay, so Callista's going to feel this cuff getting really, really tight. And as it gets tighter and tighter, the blood flow actually stops there and doesn't go down to her fingers very briefly. Still going up and down. I don't know if you guys can see. And then it's going to start relaxing a little bit, and then it starts measuring when the blood flow starts up again. almost there. Okay, so Callista's blood pressure 116/90. That's perfectly normal. And then her heart rate is 83, so perfect. Okay, great, thanks very much. So the blood pressure here, there's two numbers. The top one, the one, was it 116? The 116 is the highest pressure that reaches in the blood vessels, and that's just when the heart first pumps. So when the strongest push of the heart, that's when you get the highest blood pressure. And then when basically the muscle of the heart is pumping and then relaxing, pumping, relaxing, pumping, relaxing. So when it relaxes, that's when you get the lowest pressure, and that's the one here, which is 90. And if the blood pressure is really low because somebody's either had a bad infection or they're bleeding, you'd see something like 80/40. And if they have high blood pressure, which you can get as you age, they might have a blood pressure of 150/90, and that can have some health problems down the road. But your blood pressure is perfectly normal, so that's great. And then your heart rate also is just how fast the heart beats. And if you're running and doing exercise, the heart needs to beat faster because it needs to move more blood. And 83 is normal. Okay, so that's the pressure. So that's actually just the amount of force, I guess, that's being exerted by the heart when it pumps the blood to that area. The next thing we can check is how quickly the blood is flowing. So, what's your name? Miriam, can I just, if you could take off your watch on the right hand. I'm just going to put a little dab of gel on your wrist here, okay?
This is not going to hurt.
Right? No, not at all, no. So this is something called a Doppler probe, and it's sort of like how a dolphin uses sonar to know when something's coming at it. It shoots sound waves, it bounces back off a fish or whatever, and then comes back, and the dolphin can know how far the fish is based on the wave bouncing back at it. That's what this thing does. It shoots a little wave into the artery, which is just under her wrist, and then the blood will be flowing at a certain speed, and the Doppler probe senses how fast that blood is flowing. So we'll have a listen here. Sorry, my hands are cold. Let's go. Guess that works better. I don't know if you guys can hear that. This thing's not loud enough. But can you hear that? Yeah, so that's the blood flowing through this here. Let me just clean that off for you. Okay. There you go. Okay, thanks very much. Okay, so that's just the blood flowing in the artery. And it's a way that we measure how fast the blood is going through that particular area. And so in people who have issues with blood flow, we check the blood pressure, and we also check how well the blood is flowing and how quickly the blood is flowing. And if you have a narrowing in the blood vessel, like what's shown here, when you check how fast the blood is flowing there, it's actually flowing really fast. Like when you put your finger on the tip of a hose, the water shoots out faster, right? It's the same idea. So if the blood vessel has a really tight narrowing and you check how fast the blood is flowing there, it's flowing very quickly. So that's how we identify areas of narrowing. And if there's no flow at all, then it tells us that the artery is blocked. So my research has to do with poor circulation in the legs. And it's also what I do clinically, so taking care of patients with poor blood flow in their legs. And that happens because calcium and cholesterol build up on the inside of arteries over time, and over time narrow down how much area there is for the blood to flow through. And so when this gets really tight in this area, the muscles below it start not getting enough oxygen. And so when somebody walks and they have a narrowing in their artery, the muscle below it will start hurting because they're not getting enough oxygen while they're walking. If it gets really bad and really narrowed down or blocked, fully blocked, then the tissues in the toes can have not enough oxygen just to stay alive, actually, and they can start going black and dying. And so that's the problem with poor circulation in the legs. Diabetes often goes hand in hand with poor circulation in the legs, and it actually affects the nerves in the foot, amongst other things that it does. But because, well, I guess the next question would be, what do you know about diabetes before we jump into the foot stuff? Yeah, so there's two types. Type 1 is an autoimmune problem where we don't know exactly what causes it to happen, but the pancreas, which makes insulin, stops making the insulin, and so then your body can't use sugar the way it needs to. And then type 2 is something that usually you develop over time as you age. Do you know what the underlying problem is with diabetes? This is a harder question. Yeah? Yeah, it causes a range of problems but the underlying problem is that your blood sugars are higher than they should be. And it's because of what's called insulin resistance, or not making enough insulin. So in type 1, your pancreas, which makes insulin, which is necessary for cells to absorb sugar and use the sugar in your body, the insulin stops being made by the pancreas. And that is from what's called an autoimmune disease, where your body's sort of attacking itself. The more common type is type 2, where the insulin is being made, but it gets to the cells, and the receptors on the cells don't accept it. And so you get what's called insulin resistance. And so then even though there's sugar floating around your body, your cells can't use it because the insulin is like the key that opens the door for the sugar to get in the cell. And so the key just, it's not fitting and the door is not opening. And so the sugar doesn't get used and it builds up in your blood. And you try and have to raise up that sugar level higher and higher so that some of it can get through, but it's not quite enough. And so the problem, a couple of things to know though, that there are some myths about diabetes that are worth talking about now. The first is that eating too much sugar doesn't cause diabetes. If you eat more calories than you're using, so if you're not staying active and you're gaining weight, that over time is a risk factor for diabetes, but it's not the fact that you're eating sugar. If you eat a pound of ice cream a day, but you're running, you're running a marathon every afternoon, nobody does that, but that's not going to lead to diabetes. It has to do with how much calories you're taking in versus how many calories you're using in the day. The other thing is that people don't give themselves diabetes. It's not just about what you may be eating and how active you are. There's a lot of genetics involved. There's a lot of environmental factors, the types of foods that are available to you, the types of foods that are offered to you at events like this, and also the level of physical activity and what you're eating has an impact. But there's lots of things that you can control and others that you can't. But the main problem once you have diabetes is that the blood sugars the sugar levels in your blood are too high, and it's those high sugars that start causing the problems that people hear about in diabetes. And when it comes to the foot, what the high sugars do is that they affect the nerves. So people who have diabetes over time, if the sugar isn't well controlled and kept low in the normal range, the nerves stop working well and people don't have good sensation in their feet, meaning that you can touch their foot but they may not feel it. And so somebody could walk around all day with a stone in their shoe, pushing into their foot and causing a little wound, and they wouldn't know it. So that's how diabetes puts people at risk of getting wounds on their foot. And then if they also have poor blood flow, the wound, once it's there, doesn't heal because there's not enough oxygen. So those two things together make for a bad situation that puts people at risk of actually potentially losing their foot. So this is kind of a gross picture of what happens with peripheral artery disease. So if there's not enough blood flow down there, the tissues can die and get mummified, so they get black. Fortunately, if you can improve the blood flow down to the foot, it can actually get better. And so this on the right side here is the same foot that's fully healed after the surgery. If you can't heal it, this ends up progressing higher up the foot. In diabetes, it's a similar thing. You get wounds on the foot. This is a picture that's not as gross of a smaller wound on the toe. This happens again because the nerves aren't working well in the toe. So this person couldn't feel their toe very well and was walking in a shoe that was probably rubbing on their toe, rubbing and rubbing and rubbing, and it caused this wound. And the good news is in both of these scenarios, we can heal these wounds if we can fix the blood flow and make sure there's no more rubbing and injury and there's no infection that needs to be treated. And as you can see, this went on to heal nicely. So the problem is that there are some people, unfortunately, where we can't fix the issue or we don't get there in time and they end up losing a toe or losing a foot. And as you can imagine, that's a pretty awful thing to have happen. And so my focus for research and what I do day to day as a vascular surgeon is to try and prevent this. So the research itself, what we did is we did something called big data analysis. So you try and identify, as we're getting more and more records electronically of what's happening in our healthcare system, and businesses are doing the same, they're able to analyze large amounts of data. And in these analyses of large amounts of data, you have a huge number of patients, and you can look back and see what happened to those patients and see how perhaps their care could have been better to prevent bad outcomes like amputation. So we basically looked back in Ontario to see everybody who had lost a foot or a leg related to diabetes or poor circulation. And we wanted to see at first, what was happening to them. Was this happening more frequently over time? So this is a figure showing the number of amputations every 3 months between 2005 and 2016. So when you're looking at research stuff and you're presented with figures or pictures or tables, the first thing to do is obviously look at the title to try and figure out what the figure is about. And this one's about amputation over time. And then the two axes will give you all the information that you should need to have. So the x-axis here is the year. So as you move from left to right, you're looking at something changing over time, over the years. And then the y-axis is telling you what exactly is changing over time. So the y-axis here is the number of people having an amputation who are over, well, when we take that as a rate over the number of people who are over 40 years old who might be at risk of amputations. And so what this is showing is that across all of Ontario, if you take everybody over the age of 40, every year since 2007, there's an increasing number of people, unfortunately, who are having a foot or a leg amputation, which is discouraging because, as I said, a lot of these things are preventable. So when you're looking at this, the first thing in research is you try and start with the simple stuff, and then you have to think about why it might be happening and what you can do to test your hypotheses as to why it might be happening. So in this particular figure, we're seeing that the rate or the number of amputations is going up. And if we're looking at the red line here, it's related to poor circulation, and the green line is related to diabetes, and they're pretty closely intertwined. But it may be that the number of people in Ontario who have diabetes and poor circulation is going up. And that may explain why there's more people at risk of amputations, and so more people with amputations. And we know that in Ontario, diabetes is about 10% of adults, and it's supposed to go up to about 12 or 13% in the next 10 years. So it's becoming more and more of a problem. And that's probably why we're seeing more foot problems, just because we have more people who have diabetes to begin with. So this is just to show what's happening with this problem, and is it becoming more of a problem or less of a problem. And most things in medicine, we're actually seeing improvements. So if you're looking at heart attacks or strokes, like problems with the brain, we're actually seeing that those things are going down. But when it comes to foot problems, they're actually happening more often, which is frustrating because it's preventable. So here's another study that we did where we looked at the number of amputations that were happening in different regions across Ontario. And so this map is color-coded. So the darker orange is the regions with the highest amputation rates. So the greatest number of people getting an amputation when you standardize it for the number of people living in these regions. And in green is the lowest amputation rates. And so when you look at this, you can't know exactly why, around Toronto or in the suburbs, the amputation rate is lower than it is up north, or why, the area around connected with London is the same as the area connected with Hamilton, but higher than the area connected with Ottawa. But you can start thinking about why that might be. Does anybody have any ideas or thoughts as to why it might be difficult up north in Northern Ontario to get proper foot care? Yeah.
There's like more like hospitals and medical facilities, so they have access to like more medical treatments than people in the north.
Right, so that's definitely true. The areas up north, people are living in rural areas. There's fewer hospitals. It takes them longer to get to the hospital. They probably don't have as many family doctors, and we know that they don't have access to vascular surgery as easily as people do in the bigger cities. And we've looked at that and shown that, you know, around Toronto, there's many more vascular surgeons who are working, and there's many more people who are actually getting those surgeries to try and save their leg before the amputation. Whereas up north, probably because there's a delay in getting access to care, people aren't seeing a vascular surgeon. They're not seeing the types of people they need to see to save their leg. But what about, you know, if you're looking at a place around Hamilton versus Ottawa, where, you know, they're both sort of similarly rural in that people have similar access, what might explain differences between regions that have similar access to care? Yeah. Yeah, so there could be, I mean, these are all hypotheses, right? So when you're looking at a map like this, you just come up with potential reasons why it might be, and then you have to think about, well, how can I try and help figure this out? And it's usually not just you. You usually need a whole team of researchers and working with people across the country and working with people who think differently from you to try and come up with potential reasons and confirm that they're true and then come up with potential solutions. So certainly, yeah, there's the environmental factors. You know, how far do you have to walk to get to work? Do you drive to work? Do you smoke more in this region versus around Ottawa? Are people more active around Ottawa than in, you know, around Hamilton? I'm not sure, but there's lots of different potential explanations. But, you know, this is just an example of the kinds of, like, the preliminary work you're doing in research and then thinking about the next steps. And there's always next steps and there's always more research to do, which keeps things interesting. So that's kind of it for the research results. Basically, the messaging about how to keep, you know, your feet healthy if you have diabetes or poor circulation or you're a smoker, which puts you at risk of poor circulation, is to check your feet every day. So look between the toes, look under the feet, look on the tops of the feet, around the ankles. And if you know, patients who have diabetes or poor circulation or smokers, you know, you need to empower people that it's their health, right? And so everybody just needs a little bit of encouragement to be checking their feet regularly every day, and if there's any problem, then speak to the doctor right away. But the bigger thing is, how do you prevent people from getting diabetes and poor circulation in the first place so that they don't even have to worry about checking their feet? Well, the first thing is, don't smoke. Smoking is the #1 risk factor for poor circulation in the legs. And it's a very high risk factor for losing your leg if you have poor circulation and you keep smoking. The second one is to eat a healthy diet. So you don't want to be eating more calories than you're using. And then there's certain types of things that are higher calorie and not as good for you. So very processed foods are worse. The Canada Food Guide just came out. I don't know if you've covered that at all in school, but it's a new revamp, and it's a good source of information about the kinds of things that you should be eating to stay away from diseases like hypertension and diabetes and poor circulation, heart disease, and whatnot. And then lastly, stay active. So you know, that goes for all sorts of different chronic issues, but running, walking, any type of exercise helps the circulation in your legs, and it helps you burn off the calories that you're taking in, so prevents diabetes, poor circulation, and any foot problems. And that's it. Thank you.